I'd like to welcome you to this edition of the award-winning PRS Journal Club podcast with your hosts, Drs. Francesco Egro, Nicole Phillips, and Ira Savetsky. Enjoy.
Hi, everyone, and welcome to the October 2018 edition of the PRS Journal Club podcast. I'm Ira Savetsky, PRS Resident Ambassador from NYU, and as always, I'm joined by my co-resident ambassadors, Francesco Egro from the University of Pittsburgh Medical Center and Nicole Phillips from the Harvard Plastic Surgery Program. Today, we have the great honor of being joined by Dr. Gordon Lee, Professor of Plastic Surgery at Stanford University, where he is also the Residency Program Director for Plastic Surgery, Director of Microsurgery, and Associated Chief for Clinical Affairs. Thank you so much, Dr. Lee, for joining us for this PRS Journal Club podcast.
Well, thank you for having me.
A quick reminder, all of the articles that we will discuss can be read for free on prsjournal.com, including an archive of all past Journal Club articles. The article we'll be discussing is The Public Face of Rhinoplasty, Impact on Perceived Attractiveness and Personality by senior author Dr. Neil Tanna from Northwell Health. I chose this article because while there have been many studies that show individuals who undergo cosmetic procedures report high rates of satisfaction as well as improvements in body image, resulting in increased psychosocial functioning, there is a paucity of studies investigating the impact of cosmetic procedures, specifically rhinoplasty, on others in the patient's social surroundings. The authors talk about the importance of first impressions and that based on previous studies, an opinion of a person's attractiveness, likability, trustworthiness, competence, and aggressiveness based on facial appearance can be formed within a tenth of a second, and that this opinion does not change with longer duration of time. Other studies suggest that characteristics like agreeableness, conscientiousness, extroversion, and dominance can be accurately determined from first impressions. The nose in particular has long been recognized as playing a central role in the face both physically and psychologically, and therefore aesthetic rhinoplasty carries significant weight for affecting a patient's overall appearance and self-perception. How others perceive a patient certainly contributes to her psychosocial well-being, but this has not been specifically and objectively studied. In the study, the authors assessed the impact of rhinoplasty on public perception of a patient's appearance and personality. A survey was created using standardized before and after photographs of 10 Caucasian women who had undergone primary rhinoplasty. Photos of 2 additional women who had not undergone facial surgery were randomly included as controls for a total of 12 survey items. Pre- and post-operative photographs were placed side by side. The survey was administered via crowdsourcing. Respondents were asked to evaluate which photo better represented 11 traits of appearance or personality, including symmetry, youthfulness, facial harmony, aggressiveness, likability, trustworthiness, confidence, femininity, attractiveness, approachability, and intelligence, according to a 7-point scale. A score of 1 meant the preoperative photo was much better, 7 meant the postoperative photo was much better, and 4 meant no difference. In terms of results, there were 264 responses that were received. The majority of evaluators were male and between the ages of 25 and 34. In 10 of the 11 categories that I had mentioned previously, the post-operative photo was significantly favorable compared to the preoperative photo. The greatest value changes in ratings were seen in attractiveness, likability, femininity, and confidence. The preoperative photo was rated higher only in aggressiveness. The same scores were calculated for the controls, and there was no statistically significant difference in any category was seen except confidence, where the right image was viewed as more confident. No significant differences were found between men and women or between age groups for any trait. Overall, I think this was a really interesting study. This is the first study examining public perception of rhinoplasty patients. The results provide additional new evidence on the psychosocial benefits of cosmetic facial procedures, specifically rhinoplasty, and that women who undergo rhinoplasty are perceived more favorably by others on a variety of personality characteristics. While it was a small number of patients that were evaluated, an additional potential weakness is that the majority of evaluators were male and were between the ages of 25 and 34, and perhaps a more diverse group of evaluators would have been a better representation of overall public perception. It's also possible that despite of how the photos were displayed and how they were randomized, the evaluators may have figured out that these were indeed pre- and post-operative photos and that investigators were looking for positive ratings of the post-operative photos and may have skewed the evaluators' assessment and adjusted their ratings accordingly. Nonetheless, I thought as a whole it was a interesting and thought-provoking study, and it's a study that could potentially be used to help counsel, encourage, and set expectations for the rhinoplasty patient. Dr. Lee, I'm curious to hear some of your thoughts about this paper.
I thought this was a very, very interesting paper, and I enjoyed reading it very much. I agree with all of the points that you mentioned as far as some of the limitations of the study, but also just the way it can obviously make us think a little bit differently about rhinoplasty and show that clearly, just based upon just doing a rhinoplasty, that people's perception of the individual can change, as you mentioned, in terms of facial harmony and symmetry, youthfulness, confidence, and those kinds of characteristics that the authors have studied. I think that when counseling patients for rhinoplasty, I might be a little bit concerned about potentially sharing this information with patients, only because I think it could potentially raise their expectations as far as what they hope to get out of the surgery. In other words, doing a rhinoplasty is going to help correct things about their nose aesthetically, but I think it could also send the message that patients are going to be more attractive, confident, all those kinds of elements. And that may be true, but I think it could also artificially elevate their expectations.
Yeah, I agree with that. It would be something that I would be hesitant to share up front, but certainly if a patient were to inquire about some of these attributes, it is interesting that there is some evidence in support of it. We are sort of always taught that typical red flags in cosmetic surgery, if a patient comes and they say, I want this procedure because I think it's going to help me get my job promotion or get together with an ex-spouse, I think, we're always taught we should be very hesitant before performing that procedure. Francesco, what were some of your thoughts about this paper?
I thought this was a really interesting study and with rather surprising results, but I really enjoyed reading it. I honestly would have not expected that a change in nasal aesthetics would have had such impact on perceived personality characteristics. So I really commend the authors for the study, and I agree with both of you about the skepticism of potentially sharing upfront this information because, as you said, Ira, we are taught that wanting to change, do a procedure for example, a job or something along those lines is a red flags. But while I think these results are very interesting, I wonder, can they be truly applied to the US, since the US is such a multicultural society with various races and ethnicities, and the samples are from Caucasian women only. Perhaps a more diverse group should have been picked. What are your thoughts, Dr. Lee?
I agree. It's a very interesting study, but the fact that the study population or the subjects that were presented were primarily Caucasian women, I think the conclusions are primarily limited to Caucasian women. In the U.S., obviously, it's the great melting pot of cultures and ethnicities, so a larger study would obviously need to be performed in order to account for ethnic differences, etc. And so I think that this is a great first step, but there clearly needs to be another study done that includes different ethnicities.
Thank you so much, Dr. Lee. Nikki, what did you think about the paper?
In addition to studying, other ethnicities, one of my questions reading this was, well, what about the male rhinoplasty patient? So certainly, as we've pointed out, room for further studies. Dr. Lee, one of the things I wanted to ask you about was, I've heard a lot of aesthetic surgeons sort of bemoan how difficult rhinoplasty patients can be. And I thought it was interesting that the authors said, listen, look at the findings of the study. This basically says that, their concerns are legitimate. What did you think about that theory, that the proposed relationship between physical characteristics and perceived personality traits lends more legitimacy to patients' concerns? Then again, we've already sort of said, well, we're all a little reluctant to share this with patients, but then does this information, influence the way that we interact with patients?
Those are fantastic points. I think that this paper does give some credence to the fact that changing one's appearance, facial appearance, that doing a rhinoplasty can in fact affect people's perceptions in terms of confidence and trustworthiness. It gives some credence and validation to those kinds of arguments. So I agree with you. I think that we need to rethink a little bit about this, that there is in fact a correlation with the appearance of one's face and how they are perceived by others. I think the limitation to the study also is that clearly the participants for the source crowding are primarily male between the ages, as mentioned, of 25 and 34 or so. for that reason, I think it would be nice if there was a larger population. This was, again, about 200 or so plus participants who rated this. It'd be nice to see a larger study, particularly in social media, where potentially you could get thousands of people looking at these photos. But I do think it gives some credence to the fact that changing one's appearance can change their personality traits, at least perceived by others.
Great. Thank you so much.
I really enjoyed this discussion. Thank you, everyone, for bringing up such great points. If you like this podcast, please feel free to share with your colleagues and friends and rate us in the Apple iTunes Store. Also, remember to tune in to the other 2 articles that we'll be discussing in this month's podcast. And finally, please join us this month for our monthly journal club on Facebook, where we will be able to interact directly in real time with this month's selected articles' authors. Go ahead and like the Plastic and Reconstructive Surgery Facebook page if you have not yet done so already, and it is there where our monthly journal club takes place. And once again, thank you so much, Dr. Lee, for joining us. It's really been great having you.
Well, thank you. It's been a pleasure.